Hello, everyone. I'm here with Dr. Artour Rakhimov. He's been teaching the Buteyko method for more than 17 years. He has over 10 books on Amazon. He's a breathing retraining teacher. And honestly, he's really responsible for saving my life. I've really went through a lot of health issues, and Dr. Artour has been one of the biggest examples for me to follow and learn from. So how are you doing, Dr. Artour?
Yeah, thank you, Kierman. Yeah, thank you for hosting this call as well.
Yeah, absolutely. Yeah, I wanted to get some information from you on the COVID-19 situation. This is a really big thing right now, and I know just from studying your stuff how much information you have to share about health and prevention of disease. So I'm just wanting to get into that right away. So where do you see infections in health in general? So when we're looking at the broad scheme of health, for infections, is it something where we should be able to fight it off right away, or how would that work according to your method?
Okay, I'm going to kind of provide my overview probably from Dr. Buteyko's viewpoint, from our understanding of breath, and I'm talking about, of course, autonomous or unconscious breathing and their place in health, and how infection influence breath, and how breath also influence infection. But before even going into this discussion, I want to make kind of a really strong claim that I believe that breathing retraining is able to reduce mortality from COVID-19 by more than 10 times in people who are not sick yet. Like, let's say, if we retrain breath in people, and I'm going to explain how it works and what would be the results. And also to reduce mortality, even in those cases where this disease already started. People have active infection, and of course we have coughing and shortness of breath, fever symptoms that we are going to discuss. In these people, I expect at least 3 times reduction of mortality is possible if we take just general population who have this condition, or select groups of people who do not have many additional health problems, let's say like heart disease, diabetes, cancer, and sometimes people have many health conditions. And then, of course, to reduce mortality for this group of people would be much harder. So, but going back to this general topic about place of infection, how Dr. Buteyko viewed it, and in terms of breathing retraining, we know that, for example, if we consider flu or influenza, it's on the one side, it's extremely common type of infection, which happens in people with asthma and many other conditions as well. So, and Dr. Buteyko kind of, when we were studying infection, defined that there are actually different levels when these various type of pathogens can exist, and how we integrate, how we relate to breath and influence our breathing. So we know that some pathogens, for example, can make people stuck at 25 seconds of breath holding time. And if people progress, they can get like some really unexpected, very strong results on the body. Some of them are up to 30, 35 seconds. But what we also know that actually respiratory pathogens, they are among the easiest ones. That means, first of all, they are, of course, extremely common, as I already mentioned, in people with asthma. And we have literally, like even among those students whom I trained, hundreds of people, both with lung infection, lower respiratory infections, and sinusitis. Many people actually with sinusitis are already teaching the Buteyko breathing method for years successfully. And we have, of course, a lot of former asthmatics among Buteyko practitioners all over the world. So what happens in this group of people is that there is one very important kind of threshold which relates to level when people are able to overcome symptoms of infection. So, and for example, when we are talking about COVID-19, it's worldwide kind of accepted now approach to the condition that people need to experience 3 symptoms in order to kind of suspect that they probably have infection. And that is fever, cough, and shortness of breath. So fever, like it seems to be a mainstream approach right now, that like doctors say it's a normal reaction of the immune system. The immune system try to fight certain infection, like because it cannot find like kind of the key, you know, to the lock, like it works according to like lock the key mechanism. And the immune system intensifies its job a lot, like many times with each degree of temperature when people have high fever. So therefore, it's some kind of factor which we do not address. But talking about two other factors, which is cough and shortness of breath, these two factors like very directly relates to our breath. So it makes sense like to analyze these two factors. So what do we know from Dr. Buteyko theory and of course from experience of thousands of our students? We know that actually these symptoms appear and they exist when a person has less than 20 seconds for the body oxygen test. You can read it in my books on the web pages, but also like hundreds of other Buteyko practitioners tell the same when somebody has serious problems with cough. And sometimes I've seen people who were not even asthmatics, but they had severe coughing problems for long periods of time. And we know that these people would always have less than 20 seconds for the body oxygen test. Maybe I quickly refer to the table, because I want to kind of make this so that people who know the breathing retraining and Buteyko method can understand, but even those who do not understand what I'm talking about, they would be able to understand. So I'm quickly going to review a few physiological laws which are crucial in order to understand what I'm talking about. So what happens with us during the last 100 years, and this is again like first physiological law, we can say that 100 years ago people had normal breathing. That physiological norm was established, and that corresponds to health level 5. So if we look on Buteyko table of health zone, these parameters, 12 breaths a minute, see we have 5.3% of CO2, 40 millimeters mercury, 6 liters per minute ventilation. These are parameters given in medical or physiological textbooks as a standard of normal breathing for 70 kilogram person sitting at rest. So this is how they should breathe. Now, we know now that actually during last 100 years, dramatic change took place. And that is confirmed again by dozens of physiological studies. People this day, on average, breathe about twice more than the norm. So when we breathe twice more than the norm, that means what happens, let's say if we talk about the breathing frequency, that would be about health level 3, would be about 20 breaths a minute. So people breathe more fast. And because of that, we have less oxygen. So the result for body oxygen test you can find again in videos on web pages. If you exhale, usual exhalation while sitting, pinch your nose and see how long you can hold your breath without any stress at all until the very first discomfort. That would be the time. So it used to be, again, according to numerous studies done on the West, 40, 50 seconds, 100 years ago, and now it's around 20. So, and this number of 20 seconds is actually also very relevant to COVID infection. Why? Because medical authorities say these days, and you can read it like again, like kind of this is the observation from statistical results, that people who have very high chances to suffer and even die from this infection, coronavirus infection, would be people who have chronic diseases. And they mentioned common lifestyle diseases. I remember like some months ago when I was looking like what they say and how they term it, actually most sites had already 3 main killers, which is heart disease, oncological problem, cancer, and so on, diabetes, metabolic conditions and complications of diabetes, and 4th one, respiratory problems, asthma, COPD, and others. And for these 4 conditions actually became a kind of a common place in various mainstream resources. Now we say that people with these health problems actually have very high chances, have like serious problems with coronavirus. This is what we observe. And now we can also say that actually we know from Western research, and thousands again of measurements were done on people who have these health problems, that we all have less than 20 seconds for the body oxygen test. This is like one confirmation. Many Western studies which measure breath holding time abilities, and this is again not like Russian or Soviet research. I'm talking about Western studies with again a lot of scientific evidence. So the breath holding time is less than 20 seconds. It's also known, and this is what I have on the homepage of normalbreathing.org website, very, very long table with more than 35 health conditions, showing that we actually breathe way heavier, even commonly up to about 14, 15, 16 liters a minute. So we breathe even heavier, and that makes the breath holding time, how much oxygen we have, even less than in average population. So therefore, like going back to corona infection or COVID-19, coronavirus or COVID-19 infection, It seems that according to what is discovered right now statistically by, again, various teams of doctors from around the world, that this infection has very high chances to develop in people who have, again, these chronic health problems, which we already discussed, are below health level 3. We have less than 20 seconds for the body oxygen test. Or also there is another group of people. At the beginning, I remember it was 70 years. We say like those who are older than 70, then it became 65. Now it's become 60 because this is what they discover. We discover actually even those who are in 60s, even early 60s, also have very high chances. But from physiological research, we also know that actually these people have slightly worse respiratory parameters at rest. And I'm again talking about automatic or unconscious breathing, the way people breathe day and night. And that means that if we think, and I believe so as well, that average people these days, this is like my observations, results of my measurements as well, probably would have somewhere around 20 to 23 seconds for the CP or for the body oxygen test. Dr. Buteyka's called CP test, control post test. Then we can also say that actually numerous studies show that respiratory parameters in elderly people are a little bit worse. And so if you take 20, 23 and you make it a little bit worse, it would be somewhere like, let's say 15, 18 seconds. And that makes sense that, of course, in this case, these people actually would have a high likelihood of developing infections very easy, because 20 seconds, I believe, is a crucial threshold. We already discussed, for example, cough. And coughing, like again, like I've been teaching that for years without knowing about like coronavirus infection and so on, that if asthmatic or somebody else has problems with cough, I tell, well, your cough is going to disappear once you slow down your breathing and you got 20 seconds for the body oxygen test. With like all my books, you can, on the website, normalbreathing.com, I have a big chart showing that disappearance of major symptoms take place at this level, 20 seconds for the body oxygen test. And that relates to cough, which is again one of the key problems in people who develop coronavirus infection. I'm going to talk a little bit later actually about horrible or like gross mismanagement of cough by healthcare authorities, even though there are a lot of studies like showing that modern cough syrups are useless and so on. Very few doctors around the world use natural techniques how to stop coughing, because Buteyka doctors, of course, know, and our students, we teach them as well how to stop coughing really fast, naturally, without using any chemicals. So now, what I want to talk about next would be another symptoms of coronavirus, which is shortness of breath. And shortness of breath is known as a factor which actually relates to our body oxygen content. It makes sense. Like, what does it mean to have shortness of breath? Well, you feel that you're not having enough oxygen. Why? Because, well, assume that you exhale, you pinch your nose and you can hold your breath like 100 years ago, like 40, 50 seconds, a very long time. Obviously, since your body is so well oxygenated, you will not experience shortness of breath. And we know that this symptom appears when a person gets also below 20 seconds. So let's say people with asthmatics or COPD, they commonly have around 15 seconds. And when we get moderate health problems, we would likely already require more serious medication, not like bronchodilators, but maybe hormones already. We would have 10 or less seconds. And when we have 5 seconds or less, just before death, this is exactly the situation where we have severe shortness of breath. That means we walk a little bit, or we walk upstairs, maybe just like only 5-10 steps, and we feel that we cannot catch the breath. We become breathless, so we feel like the breathing gets too heavy. And that again testifies that actually the parameters of breathing is definitely way out of the norm. In one of the recent studies, I actually read that development of ARDS, and when people require mechanical ventilation, like when they really have severe inflammation in the lungs, which we are going to talk a little bit later, these people have more than 30 breaths a minute. 30 breaths a minute. Let's look here. This is 30 breaths a minute. According to Dr. Buteyka table, it's just before death. And doctors, of course, wonder, like, where they get 30 breaths a minute. Does it happen suddenly? Well, in my experience, actually, such parameters of automatic or unconscious breathing, they change usually relatively slowly. It takes a while for them to develop. And if the norm is 12 breaths a minute, medical norm. And Dr. Buteyko norm is 8 breaths a minute. This is again should be during sleep when people have like automatic or unconscious breathing. To have 30 breaths a minute that actually means that we were gradually developing hidden hyperventilation and the breathing becoming heavier and heavier. And finally, we achieved the state when 30 breaths a minute became the state of the autonomic or unconscious breathing. What is interesting, kind of, if I can point out some other of my books, like book on cancer or cystic fibrosis, or I read also such studies on HIV, for example, people dying from HIV. During last stages, just before death, for all these conditions, cancer, cystic fibrosis, HIV, there are medical studies done on the West showing that these people commonly experience, and on the cancer, there are through several studies, show that if we like written in palliative care, like when we care about severely sick people, done often like with help of nurses, we actually discovered that, for example, in cancer, there are 3 factors which makes chances when makes life is so short that we actually suspect that this person can die very soon. And this is edema, swelling of body parts. Plus, we say that breathing should be more than 30 breaths a minute, exactly the same number. And pulse should be more than 100 beats a minute. And at this situation, people have, again, very high chances to die. They require like some emergency care. So we are kind of very high chances, again, of having mortality. And therefore, like what happens here is, like we see that actually COVID-19, it's in a way, I view it as a relatively benign kind of infection. Benign in a way that actually, if we compare this infection with pandemics that we have right now, with something, let's say, what happened 100 years ago. We had Spanish flu, and somewhere around 20 to 30 million people, at least, with like moderate estimates, died around the world. Some experts say maybe up to like 40, 50 million, a lot more people. And mortality for active cases when people already develop infection for this Spanish infection was somewhere around 10%. Because for the current infection, it looks like it's around 5%. So it's actually twice less for current infection. Not only that, Spanish flu was known for killing very fast young and healthy adults. So those who like actually, and often like sick and children would not suffer. So that's kind of was quite kind of surprising feature, but it's known for infections and for viruses that they can have this type of behavior because it depends again on kind of environment and hereditary factors of humans. So for example, we know that when Europeans arrived to Americas, up to 90% of native Indians died from infections. And these were like known, it was smallpox, measles, and flu. So 3 viral infections, which like killed nearly the whole nation, like the whole civilizations, like ancient Aztecs and Incas, virtually completely disappeared because of such large mortality. So we can see that actually infections are different, but this one, again, it kind of attacks people who have poor immunity. This is like what Western sources claim. Now, I try to see like, are there any official medical kind of definitions of low or poor immunity? And well, it's like hard to find because it's true that the immune system has many different kind of systems in order to deal with different type of emergencies, like what can happen in the body, talking about like infections or pathogens. But looking from Dr. Buteyko viewpoint, it happened to me that actually there is a very simple definition of poor immunity or low immunity, which those people who know the real Buteyko method and who practice the classical traditional Buteyko method practice, we know it really well. And that relates actually to ability to, like, it looks maybe totally different from coronavirus, to ability to take cold shower. Interesting idea. What happens here is following. When we teach breathing retraining and our students start their journey, we often have like, let's say around 15 seconds would be quite common result. I would say many of my students with moderate, like mild health problems, but sometimes even 10, 5 seconds. I've seen students even like 1, 2, 3 seconds, not often though. And what happens, we start to slow down their breath and their body oxygen results improve. What happens later is once we achieve 20 seconds for the body oxygen test, we start to teach them how to take cold shower. That's quite unpleasant, of course. But what Dr. Buteyko discovered, and this is very important fact, I believe, which kind of defines how Dr. Buteyko view low immunity or poor immunity. What we were saying, Soviet doctors, because Dr. Buteyko again trained somewhere around 200 health professionals in 1960s and 1970s, most of whom were medical doctors. And what we discovered is that if people try to take cold shower too early, let's say when we have 10, 15 seconds, they are very likely to get infection. And that immediately, like what we notice when we get 20 seconds or higher for the body oxygen test, even like during daytime, not in the morning, we are able to take cold showers safely, following certain other kind of rules that we know like about how to take cold showers safely. And therefore, we can see from here actually immediately that kind of one of the biggest threshold, according to Dr. Buteyko, in understanding a difference between poor immunity and relatively like good immunity would be the same threshold of 20 seconds. And therefore, I believe kind of the biggest challenge and biggest threshold that people need to achieve in order to prevent coronavirus in terms of prevention is to have more than 20 seconds for the body oxygen test or have health level 3+. Why? Because if people, of course, have even better health, it's known that they recover faster. And there are, literally, I've heard like numerous stories, maybe hundreds of people can testify that if somebody practices breathing retraining and everybody is in the family sick with flu, and it takes what, like maybe 1 or 2 weeks, even people like have fever and suffer coughing and all these symptoms. The person who is practicing the method, and especially the higher the health level of this person, we may have like few sneezes, you know, like, or we may have like for 1-2 hours, like feel a little bit headache and so on. And that's it, because our immune system generally like defeats numerous pathogens every day, and we don't even notice it. So, but only certain pathogens, like as it happens with this infection, are able to produce damage. So that's about this part.
Yeah, that's that's so much, and honestly, it's amazing to me how much information there is to learn about natural health and the Buteyko method, and it's amazing how like official medicine doesn't even recommend breathing out of your nose, right? And so that's like, to me, it's sad and somewhat funny that with all this prevention, they're not even talking about breathing out of your nose, which is like the first step in this method. So that's amazing to me. But yeah, thank you for all of that. And so what are the main ways that the Buteyko method can prevent COVID-19? So you're raising the immune system. We're obviously preventing it through better immune health. What are some of the other factors that would help people if they use this to help prevent even getting it?
Well, other factors we can talk about application of lifestyle of Buteyko breathing method, as well as application of sleep-related activity, physical exercise, and changes in diet. These are all very big topics actually in relation to even general, but in coronavirus infection as well. So I'm going then to talk a little bit about both prevention and treatment, because again, as I already mentioned, we can reduce mortality a lot, many times, depending on which groups we take, and even in those people who already have infection, it's very highly likelihood. Now, what would be activities which relates to particularly the Buteyko breathing method? We address lifestyle. And I'm going to start here like to discuss lifestyle, and we can talk, for example, about how coronavirus infection develops, and people get, of course, more sick, and some people then get acute respiratory distress syndrome. We get inflammation of the whole lungs. We can be put on mechanical ventilation. And then, of course, mortality is extremely high, like up to 40-50% when people already get to the stage when we require mechanical ventilation. Now, the question that I'm going to ask here would be following in relation to lifestyle. What would be the time of the day when people have highest mortality? And you know, from numerous research, and I have this research again, when I was writing a book for practitioners, for Buteyko breathing teachers, big book, Normal Breathing, the Key to Vital Health, I found numerous studies, probably 11 or 12 studies, done by Western doctors, of course, who found that actually regardless of the name of condition, and that also relates to those conditions where people die from lung failure, for example, and it relates to people who having, for example, asthma attacks, and people who relates to COPD attacks. So these are kind of very close conditions because it involves, again, damage done to the lungs. All these studies testify, and that's common for chronic diseases in general or lifestyle diseases, that people are most likely to die during early morning hours. So this is like, again, physiological law from medicine, and that is from 4 to 7 o'clock in the morning. So if people die during sleep, it makes sense that certain sleep factors should be crucially important for our health. And here we have another gross mismanagement by modern healthcare of sleep in people. For example, if somebody gets coronavirus infection, very few doctors actually around the world would teach the patients how to sleep correctly, what would be correct factors related to sleep. And the same would relate to people who already have active coronavirus infection, and they are, let's say, already in hospitals and clinics, they are taken care by doctors. What would be, again, management of sleep by these doctors? And that's, again, another gross kind of reliance on what we are taught in medical schools and ignorance of sleep factors. Why? Because in 1960s, Dr. Buteyko discovered that there are 2 sleep factors which are literally like seen. You can see right away in patients, which could be, one of them relate to sleep position. So people can sleep, of course, most people have sleep these days in horizontal position, and it can be chest, right, chest, left, right, or on the back, or supine sleep, so-called. So, and Dr. Buteyko discovered actually the same that more than 25 Western studies discovered it as well, done by, again, Western doctors who never knew about Buteyko briefing or briefing retraining. They were just testing when people have most chances of attacks, exacerbations, in which sleep position would produce the worst results. And they found that actually supine sleep was the worst. And therefore, it makes sense that Dr. Buteyko started to teach his patients to avoid supine sleep. So this is very important part. Why it relates to, again, modern healthcare and mismanagement of modern kind of mainstream medicine. Because these days, if you go to common wards and see how patients lie, most of them would be lying on the back. And that's, of course, causing devastating effects in terms of people continue to hyperventilate and breathe even more when they go into horizontal position. The carbon dioxide level drops even more, and results for the body oxygen test would be less. They would have less and less oxygen. And that can cause, again, like, it can cause heart attacks, it can cause problems with, severe problems with lungs. So that's one factor related to sleep. Another we already mentioned that relates to mouth breathing, because mouth breathing can occur also during sleep. So if it happens during sleep, of course, people open mouth, and that, again, like an additional very negative factor which exacerbates it. People would get more coughing, more CO2 losses, less oxygen, big problems with less nitric oxide, which is not inhaled any longer, which is not able to disinfect lungs. There are many other effects. Science has somewhere around 18 to 20 independent effects related to negative effects, again, of mouth breathing. So if it happened during sleep, it can last for hours, because very strong fact. And that's, again, like mismanaged by doctors, because those who care about clinical patients in clinics, for example, or even family physicians or general practitioners, they would virtually never teach, with very few exceptions, would very rarely teach their patients, for example, how to avoid supine sleep, how to tape mouth at night, and so on. We have these instructions people can get online, like, for example, normalbriefing.org, and see models and see how to use these techniques. So that's about just in relation to sleep. Now, we already considered such factors as cough. Now, physical exercise is a huge topic, but doctors do not encourage physical exercise. This is another kind of, and we do not understand that actually physical exercise should be done in order to be safe and effective with 100% nose breathing. So very, very important factor. And how to teach physical exercise probably would take a very long time for me to explain. I would not go into this topic, but having physical exercise is crucial. And I know after, again, years of teaching of students, to achieve any of this level, 20 seconds, 30, 40, 50 seconds, people need or require a certain amount of physical exercise. And I'm talking here about morning results, like when people have results for the morning body oxygen test, because that's, I believe, the most important factor which reflects our health. So physical exercise is a huge factor. And doctors, again, mismanage it. They don't understand how to teach it well. And that's like a big kind of negative factor, which does not allow good recovery of people who are already sick with coronavirus infection, how to do exercise safely, and as well as those who try to prevent it. Like if we ask the physicians, what should I do? Kind of very few, again, would give them a proper or like a solid advice in order how to do exercise safely, how to get most benefits from physical activity. Now, next factor would relate to diet. And the diet, I believe it's crucial kind of in relation to late stages of coronavirus. Why? Because we already mentioned, and it's known that people with COVID-19 infection, when it gets severe, they develop ARDS. And this is acute respiratory distress syndrome. And this means that actually whole lungs get inflamed. It's not just bronchi or bronchioles, because if you look at airways of asthmatics here, these parts would be only inflamed. But when we look at, again, what happens with COVID-19, and this is why we get so low oxygen content, the alveoli get inflamed. So this is a big difference, because it's like much worse than asthma. It's huge area, like the huge area of lungs get inflamed, and oxygen level drops a lot because of that. So now, question here is following, of course, like how this inflammation develops, because you would expect that it does not happen all of a sudden, like out of the blue, like the same as we discussed already with respiratory rate. So those who with ARDS, we don't get 30 breaths a minute, in one day. It's a gradual process, and we already at the beginning had elevated or increased frequency of breathing, and of course, the breath holding time was also reduced before that. In relation to inflammation, it's a similar story. Actually, measurements of inflammatory markers done on patients who already got initial stages of coronavirus infection or COVID-19 infection show that they commonly had elevated inflammatory markers, common inflammatory markers. Now the question is, okay, if people have inflammatory markers, what should be the strategy here? Well, we know that actually inflammatory markers can be reduced, and there is a lot of research these days. And here I probably can tell that there is like one totally great and positive change which took place in healthcare, and that relates to diet. Why? Because 10 years ago, if we look at recommendations from virtually all type of organizations, let's say related to diabetes or heart disease or some other like serious health problems, they would say like, oh, like food pyramid, you remember, like grains and so on, like at the bottom, and other types of food. Now, I myself was really surprised, like, because during last 3-5 years, there was dramatic change. Because even now, if you go, let's say, like official website, Google, if you try like diet for cancer or diets for some other conditions and diet for COVID-19, actually what happens for those conditions, which are chronic diseases, modern healthcare sites would suggest that it's low-carb diet. And not only that, we now know that for people who are very sick, and that again, I'm talking about people, let's say, who have already ARDS or inflammation of the lungs, what they can do in terms of diet, because that's another kind of very powerful remedy, which could be used even alone, like without kind of addressing other factors we discussed, like how to manage cough, how to relation to sleep and so on. Encourage people not to spend too much in bed. I did not discuss these factors because Buteyko doctors were teaching how to restrict sleep by 6-7 hours, because if people have highest chances of mortality, like, and highest chances to die, highest mortality during early morning hours, well, if we shorten sleep, we have more chances to live. So therefore it makes sense to restrict sleep. But in modern kind of mainstream medicine, we even don't think about that. You know, I believe kind of in the idea, which recently like kind of happened to me, that the whole healthcare system has a very big flaw related to its health care. healthcare means like they say, oh, you did not do anything wrong with you, and we are going to help you, most likely, of course, with drugs. And so, and care, therefore, means kind of, we're trying to help you. What does it mean? Well, if you cough, well, we'll try to find drug for you. You don't need like to close your mouth, cough through the nose, try to suppress cough and get more CO2 because we know it works. Or people say, I'm tired, I cannot do physical exercise. We say, don't do physical exercise. And then somebody says, well, it's heavy for me to breathe. And doctors say, well, don't worry, we'll make machine to breathe for you. And then, of course, chances of dying, like it's, I'm tired, we say, well, lie down, because if you are tired, you need to lie down. So see all these factors, food, eat so that you're not hungry, sleep as much as you like. So therefore, like we kind of, that's not a problem actually of only healthcare. I believe it's like the whole our civilization, like based on this idea, which Dr. Buteyko criticized, the whole idea of paradise, like a place with, again, a lot of food, there is nothing to do there. So you have, you can be lying on the back, you know, very warm place. So kind of, all these factors actually destroy our health. Why? Because a human body has been evolving, like during all our evolution, fighting for life, like surviving in different weather conditions, like before we kind of became our current us. So therefore, like it makes sense that if we don't stimulate our body with all type of kind of methods, techniques, and kind of to make it sometimes maybe a bit kind of on the harsh side or ascetic side, the body is going to rot, to decay, and diseases develop. So that's position of Dr. Buteyko. So going in relation to diet, like doctors these days, that's kind of a biggest change, shift took place. And great that also, like I know that leading medical schools around the world started to include diet courses. But talking about diet, actually, there is even one more stop, not just using, let's say, low carb or ketogenic diet, like there is therapeutic ketogenic diet with probably by now thousands and thousands of studies, very good support, showing that actually inflammatory markers are reduced. But I believe there is even stricter diets would be even more beneficial, such as, for example, PKD, Paleolithic ketogenic diet, developed by doctors from Paleomedicina. And this again, like this a medical kind of medical clinic where several medical doctors work, led by Csaba Toth and Dr. Zsófia Clemens. So we have many publications with totally outstanding results. Like first time in the history of medicine, we show that we could manage diabetes 1, type 1 diabetes patient, like was just a case study, but we had many other people as well, as we say in the resources, who manage diabetes 1 alone, like with diet only, without applying any therapies, but this diet has 0 carbs. So it's like basically carnivore diet with many other rules which are required. We had publications related to glioblastomas, like reduction in size of brain tumors, one of the like most difficult to operate and very kind of lethal in terms of like people die usually in the period of 6 months once we discover it. So it's really like kind of severe type of cancer, colon cancer, lung cancer. We had cases of severe arthritis. So there are Crohn's disease, like this is like all medical sources will tell you that this is a progressive condition. It's always get worse. You can do nothing about it. Yet doctors from Paleomedicina show that we get cases when people have no symptoms, need no medication, and we show that they actually were able to even restore intestinal permeability in these patients, and get various also publications in Hungarian showing the same. So these are like outstanding research, and what we do, the kind of what we try to achieve, we try to repair the gut, normalize intestinal permeability, and that dramatically reduce inflammatory markers, and that going back completely relates to development of severe states of coronavirus infection, because people get inflammation of the whole lungs, as we discussed. And that means actually that it's very possible that diet would be a huge factor which people could use and doctors could use around the world in order to reduce mortality from coronavirus infection. That would be kind of one of the factors. And I myself, maybe I can make here kind of a statement, a claim that I believe that it's possible to have this dramatic reduction. So in terms of, again, let's say prevention of mortality, if people want to solve health problem, we can reduce mortality by a factor of 10 if we teach, for example, breathing retraining to people who do not have coronavirus infection yet. If infection started, that's already a different situation because these people already have coughing, shortness of breath. So we have a little bit worse health, definitely, in terms of breath as well. And that means situation is much more difficult to predict. It's very new. And the really huge problem here that it looks like this condition, it's in a way like extremely fast developing, because like to get only few weeks to live, like this is how fast it goes. Because we know that like I already mentioned, like glioblastomas, maybe some other like pancreatic cancer, there are certain conditions which can also progress very, very fast. But that one is looks like kind of it's even faster. And therefore I believe the time, of course, would be even more crucial here. Like it's probably even hours would be important, days to start earlier, to start application of all these techniques which allow people to normalize their breath. But results like really should be very kind of high, if very good in terms of, again, dramatic reduction in mortality, even in those who have already coronavirus infection. I may shortly mention here my understanding of breathing exercises. Kind of, we talk a lot about breath because I know that ordinary people generally imply, like you say, oh, Buteyko method, like breathing exercises. It's as Dr. Buteyko himself taught, that actually it's not how you do like certain this or this practice or this breathing exercise. It's more important where you arrive as a result of your practice in terms of what is your unconscious or automatic breathing. And that's probably the reason, of course, why I kind of was not talking much about breathing exercises. About 15 years ago, I made experiment myself with groups of my students in Toronto, in Canada, where I live already for more than 25 years. What I did, I knew that, of course, I have been teaching Buteyko method already for years at this time, but I discovered that actually exercises with Frolov breathing device were producing even better results in terms of body oxygen test, like how my breath holding abilities improved after 20 or 30 minutes breathing session. So what I did at this time, I bought 2 boxes of devices, of Frolov devices from Novosibirsk. We already like started to produce, sell it on the West. We were really like, I think $100, quite expensive, but I bought it for my students to test it. So about 50 devices. So I had many groups of students, and I was curious myself, okay, if I give them devices, and I divided groups on several different kind of scenarios. So let's say in one scenario, I would teach them first Buteyko reduced breathing exercise, since it takes an hour, plus I need to explain them sleep and other things. I could not fit another breathing exercise in the same class. I would teach them Frolov device, breathing device, which is tested again, like in Russia, by 25 medical studies, great results, COPD, asthma, many other conditions, lungs related, and so on. What I discovered is that, and then I had another group, I would start with Frolov and teach Buteyko later. And that what I would do later with all of them, after 2 weeks, when we already know how to practice Frolov and when we know how to practice with Buteyko reduced breathing, I would ask them to practice at least 1 session of Frolov or Buteyko every day. And whatever time we have, if they do like 3 or 4 sessions, we choose themselves. I said, whatever you like. And then after like this period, like some weeks period of practice, of course, we would also do more intensively when we get more kind of proficient, we know how to practice better. And what I found that actually overwhelming majority, probably 95% of students, like very few exceptions. I think I had like 1 or 2 exceptions. People would say we like Buteyko more, but again, overwhelming majority of people had way better improvements, up to about 30–50%. And since I had some people with respiratory problems, I can say that those people who had lung conditions, let's say asthma, or I had people with bronchiectasis, cystic fibrosis, these people would report even better results for the Frolov breathing device. And later I invented my own amazing DIY breathing device if people like cannot buy, so that they can do at home, like very simple vinyl tubing plastic bottle. And the results were somewhere at the level of, again, like for ordinary people, probably about 30–50% more effective time investment when we use Frolov device, for example. And those who have respiratory problems, the results were even better. So it's somewhere around probably 50-70%. So it's great kind of reduction of time, but especially when people kind of fighting, like there is high chances of dying with severe like infection develop. I believe it would be very beneficial and way more effective to use only respiratory devices at these early stages, which are also much easier to practice, because Buteyko way more complicated exercise, which I know people learn when they get 20 seconds or higher. We're able to learn Buteyko really well and fast. Therefore, for this particular infection, I believe that kind of it's definitely more effective to use breathing devices for people, but of course with certain, again, safety, because safety steps or certain kind of preliminary requirements when people need to kind of take care, like let's say use warm water and so on, so that we don't create damage for the lungs, and practice very gently. So they're kind of dependent again on the situation, on the person. But overall, the programs that I teach, of course, it's very complex. Like let's say if I even have an ordinary course, and the purpose of this course to get to people to health level 3, to have like 20 seconds in the morning or higher. A few people may get even 30 seconds during such a course. It takes me somewhere around 12 hours over a 1 month period of time. And therefore you can imagine that, of course, it's like I cannot squeeze all this information into our talk, just can outline the key principles, ideas, because it's much more information. The course, the advanced course that I teach for students even to get higher health levels would take me somewhere around 6-7 hours. I have so-called free classes for advanced course, plus the common materials that I would teach to a briefing teacher, somebody would take a briefing teacher, like when I explain all these courses, plus of course many more details related to how to apply it to children and very various health problems, and more in depth about all these lifestyle factors. Takes me, I have like at least 25 hours recordings of this course. So you can imagine it's actually a lot of information, meaning that it's a very, very large topic. But if there are any, again, health professionals who are interested in inviting me, I would be happy to come and to share with this information with like hospitals, clinics, and to help doctors to apply like these common lifestyle ideas, again, how to manage cough without medication, how to correct the sleeping, so how to tape mouth, and many other lifestyle related things, so that management of coronavirus infection is way better, because the mortality is huge. I believe like if doctors teach even as simple thing as how to stop coughing. No, I checked like even like recently, I checked once today several websites like American Family Physician, and I checked National Health System in the United Kingdom. We all even never mentioned that actually if you cough through the mouth, you should stop coughing through the mouth, because that destroys your airways. It makes coughing even worse. So you create damage to your airways by coughing through the mouth. So therefore, like, I'm willing to kind of to give help and provide kind of recommendations, guidance based on Buteyko lifestyle and other things which we discussed here.
Yeah, that's amazing and very needed for sure. There's a lot of people that would be having issues that don't need to be, because there's definitely some simple things to be done.
Well, as I suggested, kind of one of the great things would be in our body of students. We have like many supporters on Facebook, on our YouTube channel, like thousands. Mm-hmm. Of course, if they're willing to kind of maybe even to talk to the family physician. So if we know there are clinics with, for example, coronavirus infection patients, this information, I believe, would be really useful for them to apply. And these Absolutely. Are the simple things which in many cases do not require anything. You just need to modify the way you live during the day, during your sleep, and so on. And at the same time, like talking about how it can develop, it's hard to tell in worst case scenario, like because it seems to be kind of really persistent infection. Well, it may happen that it may kill many million people eventually. So, and it eventually normally infections die because of a variety of reasons. Like there are a lot of people already sick with it. We have antibodies. We cannot get sick with it anymore, and therefore other infections. But talking about again like applications of breathing retraining, there is a huge potential which health professionals should use. We have many health professionals, of course, already. In Russia, I mentioned Dr. Buteyko trained so many medical doctors, and some doctors like kind of managers of clinic and hospitals and so on. And spread of this information, of course, I believe can create huge relief, and addressing of lifestyle factors and doing breathing exercises and so on. Talking about maybe shortly, I did not mention, like people may ask like what breathing exercises generally people should do. Like this is a question I often heard during last weeks. I believe that actually it's not your breathing exercise, but which health level you are in. So if you already have a really good health level, I don't know, let's say health level 5, 6, 7, most people there probably would like steps, like very long pauses, like maximum pauses and so on. So we can do those type of exercises. But those people who are new to this and they develop already coronavirus infection, they have maybe 10, 15 seconds, like health level only 2, already heavy breathing, all the symptoms of coronavirus infection. Of course, it would be different situation. This is what I explained, that using of breathing devices would be hugely beneficial for this particular group of people. So it's, of course, a complex issue with many parameters involved, but at the same time, again, like application of simple ideas related to lifestyle management and changes in healthcare, which we have already many, as I mentioned, diet, prevention of supine sleep in people who are in intensive care or emergency medicine, when people on mechanical ventilation. So these are some of the changes, and probably with time we can expect more, but at the same time, again, like we are right here, like just people need to kind of start looking at them in more detail, start researching, starting using them on their patients. Again, like either like if these are family physicians or again people who already have infection, like talking about COVID-19. Thank you, Kieran, for hosting this call.
Absolutely, yes, thank you. It was my pleasure. You're always welcome here.
Okay,
for sure.
Bye bye.
All right, thank you.